All right, we are ready to go. Good afternoon once again, and thank you for joining the January 2021 Allscripts App of the Month webinar featuring DocBuddy. I'm Eric Sunset. I'll be your moderator today. Before we begin, there are a couple of housekeeping items to address. This webinar is being recorded, and all audience phone lines have been placed on mute. We ask that you submit questions using the Zoom Q&A feature, and we'll address those in the order that they're received during the Q&A portion of the webinar, and that is towards the end of the show, so sit tight. And now with our housekeeping out of the way, the topic of today's webinar is how to reduce time spent documenting with a mobile workflow. Our presenter is going to be Andy D'Agostino. He's the founder and CEO of DocBuddy. He'll be providing information about our HIPAA-secure iPhone and Android DocBuddy app, our integration with Allscripts, and maybe most importantly, how to start your free 15-day trial. A little later in the webinar, Andy will be joined by Dr. Ian Weber, and he's a joint customer of Allscripts and DocBuddy. He'll be providing a physician's perspective on this centralized mobile workflow solution. And with that, Andy, the floor is yours.
Good morning and good afternoon, Allscripts customers. Thank you for taking the time out of your busy schedule today to join our webinar and to learn about DocBuddy. I also want to say thank you to the Allscripts team and their partnership that they've created with us. Thank you for featuring us as App of the Month as we break in the new year here in 2021. I think it goes without saying that all of us are happy that it's 2021. Today, we're going to share some things with you that could tremendously impact your practice if you're willing to give us a shot. In fact, I believe the next 20 minutes could completely change the way you think about how to give providers back their time. You'll hear firsthand from a new DocBuddy Allscripts user, Dr. Ian Weber, as Eric mentioned, and he's going to share with you how DocBuddy has impacted his practice and how it's impacted him professionally and personally. So before we jump in today, just a quick overview of what we're going to cover. I'll share our frontline team with you, what's important to us, what we value as a company and the why of what we do, the problem we're solving, and our remedy or answer to that problem. And then specifically the DocBuddy Allscripts solution that you have a chance to take advantage of now. And I encourage all of you to do that. And I know Dr. Weber will share that as well. We'll give you a quick product demo, and then Dr. Weber will join us. He's actually graced us with a few minutes today. He's a busy surgeon, and he's in between surgery right now, but he's going to share a few tidbits as to his experience with DocBuddy over the last 3 to 4 months. And then we'll open it up for questions. This is only about 10 minutes, so sit back, and I think you're going to really be happy with what you see here. Here are many of the team members, our frontline team that you're going to get to meet during the onboarding and support process. We have many team members working in the background to make your experience with DocBuddy seamless and really just a great experience. Our team's excited to work with each and every one of you, with your practice, with your providers and support staff, and they look forward to connecting with you as soon as today. I always like to share the values of our company with our customers, just giving you a perspective as to why we do what we do. And I think when you meet our team, you're going to understand that these values really shine through and they emulate them to the best of their ability. So let's look at the problem that we're trying to solve here, the provider productivity problem. That all of you know very well. DocBuddy was founded on the mission and purpose to give providers back their time. When we uncovered how much time providers were spending away from the patient, we took it upon ourselves to actually bring time back to the healthcare system and to the organization that employ or contract them. I'm going to peel back this problem a little bit more on the next slide, just give you the cause as we've had to dig in here over the last 5 to 6 years when DocBuddy was formed. But the DocBuddy story and the solution came about in 2015. It all started with a 10 provider surgery practice here in Denver, Colorado. And they were willing to give us a shot. They wanted something different. And they were tired of the desktop-based workflow. And so we immediately rolled this out to 3 hand surgeons here in Denver, Colorado. And I'm here to tell you they're still loyal users today. 30 days after the pilot started, they actually standardized DocBuddy in their clinic and in their surgery center. They got rid of their transcription service. One of the things I remember when we rolled that product out to hand surgery associates here in Denver was I had one of the surgeons text me about a week into starting to use DocBuddy. And he said, Andy, I just dictated 4 of my surgeries while waiting to pick up my kids from school. This is a complete game changer for me. As I mentioned, this group is still using DocBuddy today in their clinic and in their surgery center. When we looked at this problem, we wanted to dig into really the cause of it. And our answer to the problem will be a lot different than what you're used to in healthcare technology. We didn't want to bring a Band-Aid to healthcare. We didn't want to bring more cost to the provider, or even cause them more time to learn a new technology. Our answer was to create a whole new way for providers to practice medicine. In other words, we wanted to completely change the game in the way the game was being played. You and I know this very well. We interact with our smartphones every day, just like we interact with the transportation industry, with Uber now when we get off an airplane, or to the travel industry with Airbnb, or the one industry many of us connected with this year during COVID. We probably use DoorDash or Uber Eats a few times to deliver meals to our door. Just like that dynamic difference, we want to bring innovation to the provider. We want to untether them from the desktop and ultimately bring mobility to their workflow and the way they practice medicine. So as I mentioned, we dug into this problem. We wanted to understand the cause. If you look at all the research publications here over the last 6 years, really the cause of this problem is narrowed down to 2 things. It boils down to 2 things, and that is providers are spending so much of their time away from the patient. And when you look at it, 2/3 of the time away from the patient, if we peel that back and think about the big picture, we're talking about a $3.5 to $4 trillion industry in healthcare. It's almost 20% of our economy. And those statistics consistently show us that healthcare and the provider, which is really the engine of healthcare, because nothing happens before a provider sees a patient, is hampered and really working at 1/3 of their capacity. And so this research and these case studies that have come out narrows it down to really this time constraint and this time barrier for providers is the accessibility of data. They need to access data to make clinical decisions on a regular basis, and all of you know that. They also need to be able to document very quickly and easily. So we took a step back, and once we understood the cause of this problem, we really began with the end in mind. And that was really to understand the solution, to bring a solution to market, and to really, as I mentioned, create a whole new way for providers to practice medicine outside their desktop, and to make it nimble, to make it mobile. And as you know, mobility is crucial for providers, especially after this year. They have demands on them that they've never had before. And so we wanted to bring a product to market that would enable and empower a provider to access data at the point of care and to document at the point of care. And that's exactly what we did. We brought a mobile solution. We knew we had to create a mobile solution that was fast, it was accurate, but in driving that point of care service for accessing data and documentation, we knew we had to create a mobile solution that was interoperable to the EMR. So the ability to read and write to the EMR, where the data flows both ways, is crucial for that efficiency. And hence DocBuddy was born, and the mobile integrator for healthcare came about. And now I can tell you that this DocBuddy solution is being used all over the country with many different practices, and they're taking advantage of this new workflow and a new way of doing things. And you can do the same with the DocBuddy Allscripts solution. So in a minute, I'm going to share with you a product demo that'll give you a much better feel as to how easy this workflow is. I think Dr. Weber will shed some light on how simple this was, and I'll let him share his experience with how he onboarded DocBuddy and how fast he was up and running. But this This video will explain to you and give you a tangible feel as to how easy a provider can access their EMR schedule and patient information. They can document any type of patient encounter. They can create and manage voice commands, which will give them standardization in their workflow as well as in their documentation methods. And then you'll see inside the app, there's a HIPAA compliant messaging system that enables providers to share information securely inside the application. And ultimately, this will bring a mobile workflow solution that will enable a provider to access data at the point of care and to document at the point of care for any patient visit. Another thing that you'll hear even from Dr. Weber is that with our Allscripts customers, one thing we found when we rolled this out was when the provider is in DocBuddy and they're documenting during a patient encounter, the chart can actually be accessed by any support staff. So a nurse or MA can actually be in that particular patient encounter or patient chart while they're documenting in DocBuddy, and they don't get kicked out. That's been a huge value that we weren't expecting. So in a minute, I'm going to introduce Dr. Ian Weber, but before I do that, here is a quick product demo just to give you a tangible feel of how the DocBuddy Allscripts solution works. Take a minute to enjoy here. All right. Now that you've seen how simple the DocBuddy Allscripts solution is and how simple that workflow is, you can envision the significant time savings that we pass on to providers. I'm going to introduce Dr. Ian Weber here in a minute, but that is really what DocBuddy is all about. As I mentioned, our mission and purpose is to bring time back to the provider and to the healthcare system. And ultimately, we understand that time equals a lot of things. So that's why we wanted to focus on time. It's our biggest commodity. It is professionally and personally. As a parent of 3 boys, time is everything with them, for me and for them. And when I lose it, I can't ever get it back. And it's the same professionally. There's no difference. There's no exception with healthcare providers as well. Time is everything to them. And nothing happens in healthcare until a provider sees a patient. But seeing these time savings, we knew that if we could focus on that, we would enhance patient care. We would increase productivity and revenue, not just for the provider, but to the healthcare system. We'd reduce that wasted time and that opportunity cost of spending time away from the patient. And that we would deliver standard workflows and standardized documentation methods. And all these things would culminate into really boosting that provider satisfaction. We understand that happy provider equals a happy patient. And with that, now I'm going to introduce Dr. Ian Weber, and he's going to share with you how these time-saving benefits have affected him professionally and personally. Dr. Weber, thanks for taking the time today. I know you're in between surgeries. Take it away.
Thanks, Andy. Can you hear me?
Yes, we can.
Perfect. So with any new technology, I'm pretty skeptical, and I usually do my research. I'm not always the first one to jump on board. And so one of the things that really stands out about DocBuddy is in the middle of clinic, I was introduced to it, and my clinics run about 50 or 60 patients in a day. And so it's pretty busy. I'm rarely sitting down. And I was able to pick up this technology in about 3 patients. Literally, the DocBuddy support service, Ashley and Shauna, everyone who works for them came in, showed me. And within about 20 seconds, I was onboarded and I was able to use it. And of course, I was like, how long do I get to trial this? Because if I don't like it, I don't want to use it. Within about 4 patients, I was sold. In fact, the first day I was using it, I think I dictated on it, and I didn't realize Ashley was actually timing me, but I dictated about 4 charts. She goes, hey, you just did that in about 1.5 minutes. And I was like, holy cow. And that's when I really noticed the power of this was it was very efficient and very time savings. One of the benefits is it's your phone. I mean, you carry your phone everywhere you go. So you can dictate in between patients. You can dictate in front of patients. If you want to come up with a plan on a complicated patient, you can dictate right there in the room with the patient. Previously, I would have a dictaphone that was attached to my computer, which was also what I used to demonstrate my PAC x-rays. And I would have to unplug, replug. Sometimes I'd have to reboot my dictaphone. And so it's very cumbersome to use my laptop as a dictating device, but also as a packs to show my patients their x-rays. So by bringing it to the phone, that was a huge advantage. The other thing is I think I've used a couple of different programs on computers, and there's nothing better than using your phone as your dictation. It doesn't misspell words. You can see in the example, you can speak in real time. You don't have to slow down. You don't even have to pause. It will capture everything you said. And the accuracy is beyond anything I've ever seen before. When I've used others, I've always had to go back and go, oh, I didn't say that. Oh, that's the wrong word. Using the phone technology for your dictation, it blows anything away that you currently have on your laptop or your computer for dictating. The learning curve is easy. Like I said, I learned it on the fly. It wasn't like I practiced. I mean, I literally learned in the middle of my busy clinic. And again, I got those patients down extremely fast. So again, the word recognition is huge. You know, you're on your phone, you carry it around. It is very convenient for your dictation. And as Andy said, what we had trouble on in the clinic is if you have PAs and you have MAs and nurses, if they're in the chart and you want to dictate something at that point, sometimes you can't get into the chart as someone else is in the chart. That's just the way Allscripts is built. With DocBuddy, it doesn't matter who's in the chart. It's going to dictate and then populate your chart. So there's no concerns of, oh, did you close out? Oh, did you hit face sheet? Did you get out of Doc? Did you get out of Allscripts? I can't get in. Who's in Allscripts? Who's in the... You don't have to worry about it. It's all on your phone. So for example, yesterday I had 50 patients, and my last patient, I think I saw at 3:30. And as I was able to dictate, I never sat down. In between patients, a little dictation before and after lunch. I was done by 4:30 on 50 patients, all dictations, all physical exam, everything was checked off. I've never been able to do that. I mean, my life used to be either come home and spend an hour and a half on charts at home or carry it over to the weekend. With DocBuddy, I don't have that issue anymore. So again, the time is huge. I've gotten it back. The other thing is on your iPhone, it's literally 1-2 clicks and you're in the chart. You click assessment, you click exam, and then that's it. And as everybody knows, our documentation has changed. In the past, it was almost as many clicks as you could put in there to get your patient levels up to a 1.3 or an 0.3. Now, as a provider, this is beneficial that everything's based on complexity of the patient plan and the time spent. So for instance, when I talk about obesity, I can do a huge dictation off my DocBuddy, and I can actually bring my level of coding up because I'm dealing with complexity of issues. So it could be knee arthritis in one knee, hip arthritis, and I could be dealing with a obesity issue. And in there, as quickly as I'm talking to the patient, I can dictate that we've outlined a more protein-based removal, and I can actually probably increase my coding because I have better documentation on what I actually talk to my patients about. So there's a lot of benefits on this DocBuddy, especially with the new coding systems and what it's based on. Your assessment and plan now means more than it ever has. And with DocBuddy, you can talk away without pausing with great paragraphs, and you can see assessment and plans that can be a page long. So you know the complexity of the patient, and it took you no time to do that. So my experience with DocBuddy has been amazing. I mean, I can't tell you how much it's impacted my ability to communicate, document appropriately, and save time. So it's amazing. So I'll turn that back over to Andy.
Thank you, Dr. Weber. We really appreciate you taking the time. Maybe just shed just a little bit more light on how this has affected you personally as well. We love that you're an outdoorsman, just like many of us in Colorado, but we'd love to just hear maybe some things that you enjoy doing outside work, and this has actually given you an opportunity to open up your bandwidth.
Yeah, so like Andy said, we're in Colorado, so I try to ski every weekend. And in the past, I could go up there, let's say a Thursday night if I had Friday off. I could ski Friday, I could ski Saturday, but I knew I had about 3 hours of dictations waiting at home. So Sunday, I would probably just opt to come home because I had to catch up on my dictations. Now that I can get pretty much everything done after each clinic day, I just ski Sunday and come back Sunday night. So, I mean, I can ski now on Sundays. And in the past, I knew I had 3 or 4 hours of dictations left to do. And I would make that decision to get up early Sunday morning, beat I-70 traffic, and head home. Now I'll just ski the whole day, eat dinner, and come home at 10 o'clock on Sunday night, knowing I don't have a single dictation to do.
That's great. We love that. That's what drives us, is just giving that time back to the provider professionally and then personally, hearing those stories of more exercise or more family time or more sleep, all of the above. That's what time equals. But now we'll jump into some questions. And Dr. Weber, I know you have to get back to surgery, but would love to, if any questions are pointed towards you, would love to hear your thoughts. Eric, do you want to moderate the questions now?
Absolutely. So now is a great time for our webinar attendees to use the Q&A feature of the Zoom meeting to shoot some questions across. We did have one question come through the chat feature, which that's fine too, but want to be sure it gets addressed for the whole room if people weren't keeping up with the chat. And the question was, what's the difference between DocBuddy and the Allscripts mobile app?
Great question. I think the biggest difference is the fact that you can document within the DocBuddy app, and that data is going to flow directly into whatever note field you want it to. We've got on-call functionality. We also have, as you saw, we've got those voice commands that allow you to standardize. You can freely dictate, or you can use those voice commands to quickly and easily process that data. So that's the biggest thing. Anything on your end, Dr. Weber, that you can mention? I'm not sure if you ever used the Allscripts mobile app or not.
I haven't used the mobile app, but one of my partners did, and it seemed like if you started an encounter on your laptop and then went to the mobile app, it actually created two different encounters on the patient's chart. I don't know if that's been corrected. I don't have a lot of success, but that was a problem, because if he was working on his phone with the mobile app and his MA was putting everything in on the laptop, it didn't seem like the two charts could be put as one encounter. So that was one issue that kind of steered him to DocBuddy as well.
Oh, thank you.
That's actually a really nice segue there. One of the questions in the Q&A is, can you see the patient's chart record from DocBuddy?
Yes, absolutely. You can click on the patient. You can see the previous visits in descending order. So that's the accessibility of data piece that we talk about, is accessing the schedule, accessing the patient demographics of the patient. That's one of the things that some of our local Allscripts providers said, I just want to be able to call the patient really quickly. Well, when you click on the patient in DocBuddy, their phone number is right there. They can click on it and call them. They don't have to go back to their desktop to look up their phone number. But yes, you can see the previous visit notes of that patient.
And then as a piggyback onto that question, we have a question from the chat. Can you access patient records in the EHR and DocBuddy at the same time?
Absolutely. That's actually, as I mentioned, it's been a huge value, is support staff can access the chart at the same time. Like when Dr. Weber is dictating in between patients or walking between patients, his support staff can be in the chart and they don't get kicked out. Dr. Weber, any thoughts on that you've seen since starting?
Yeah, that's exactly a good point. When we were doing it, if I was trying to dictate and my MA was maybe putting in the MRI order or something, and we were both in it, I couldn't get in it. And then I would get in it, and then she would go, are you in it? Do you need to get in? So it created a little bit of a workflow issue. And with DocBuddy, she just stays in her desktop, and I never have to worry about if she's in a chart or out of a chart. She never has to worry about me being in or out of a chart either. It's a very flow-like system that we have going on.
Awesome.
All right, and I do encourage our attendees to take advantage of Dr. Weber while he's still able to join us. If there's any provider-specific questions, get those over to us quickly. The DocBuddy crew is happy to go the distance with you, of course, but want to be respectful of Dr. Weber's time. So continuing down our non-provider-centric questions, one came across the Q&A, security, and I assume we're referencing HIPAA here.
No, absolutely. We are fully HIPAA compliant. We're in a private shield with Heroku, which sits on top of AWS, fully HIPAA compliant. We're getting ready to be fully ISO certified. So there's no worries there.
All right, and continuing down our Q&A list, some really good, thoughtful questions coming over, so thank you for those. How do you include procedure codes and billing levels?
Great question. So right now, we are actually building our orders and codes piece within DocBuddy. So right now, you still do that within the Allscripts platform. But soon, just like you do your documentation note, you'll be able to write a procedure or ICD-10 code to Allscripts from DocBuddy.
And if I may, Dr. Weber, can I call on you here that I would imagine with the ability to complete charts as quickly as you do, that there's really no delay in getting that claim out the door.
Yeah, that's exactly right. I mean, it speeds up your efficiency of billing because, again, we try to get our charts done in a timely fashion, but, I'm not going to stay up till 10 o'clock at night. Previously, I always carried them over to the weekends. And so, yeah, we do get our billing out much quicker with this ability for me to dictate. It makes me more compliant with what our goal was. But again, I mean, our goal was always to get our notes done. But, it's Thursday at 6 p.m. I'm not going to sit around and do 3 hours of charts. I just waited, maybe on a Sunday while watching football to do it. But now I can comply with what our goals were always. But in the past, I just wasn't going to do it because I wasn't going to stay up till 10 o'clock every night finishing my charts.
Fair enough. And like Andy said, that is a feature on the roadmap, but we have to include our stock language here to make all purchasing decisions based on currently available features and functionality. So thank you for that detail, Dr. Weber. And then continuing down our list, what percentage of DocBuddy users are primary care providers?
So we do have a fair amount of internal medicine, more internal medicine than primary care, but we definitely do have primary care providers using DocBuddy. It's all of the above from the standpoint of whatever medical segment wants to have a mobile workflow. And obviously for specialists that are in and out of the hospital, that are taking call, or that are in and out of surgery centers as well, in addition to their clinic, DocBuddy is a great fit for. But it can definitely work for primary care providers as well.
Then we've got a functionality question come across. Does DocBuddy have the ability to mask the provider's phone number, or does the patient now have the doc's personal cell phone? Andy, can you clarify there?
Yeah, so there's the patient doesn't have any direct connection to the provider, to the physician through DocBuddy. Obviously, what the physician and patient decide on communication measures outside of that is up to them. But yeah, they won't have access to the physician through DocBuddy. Great question.
All right, and we're kind of running down to the bottom of the barrel for questions here, so I encourage you to please keep them coming if they are available to send now. Otherwise, we'll be happy to circle back with you. So our last couple here are, what is the cost compared to the license for the Allscripts mobile app?
So I'm not totally sure what Allscripts charges for their mobile app, but the DocBuddy costs, as we mentioned, I encourage you to take advantage of the free trial. As Dr. Weber mentioned, he was very skeptical and didn't even want to try DocBuddy. And then we onboarded him and he was off to the races within a few patients. But ultimately, the pricing, we have customized pricing based on provider volume. But I would say take advantage of the 15-day free trial, and there's no obligation there for your practice or for any of your providers. We feel very confident that once DocBuddy's in their hands, they won't go back to the way it was.
All right, and this is, I think, going to be our final question, unless we can cover a couple of our most frequently asked questions after this. How can we get more details of DocBuddy integrating with Allscripts? And of course, Priya will be happy to get in touch with you via email. But Andy, that may be an important point to at least cover from a high level here.
Yeah, no, we're happy to share offline. We can talk directly with your practice in terms of what the technical requirements are. All that has to happen, just know that we have built this integration and we've worked closely with the Allscripts Unity developers. And ultimately that Unity platform, as you know, reads and writes to the Allscripts platform. So all that has to happen is we just turn on your practice, you download the app, and providers will immediately see their schedule and patient information to start using the product. In terms of technical specs, I'm not totally sure on what they're referring to, but happy to talk offline and connect directly with you guys.
And it looks like that's already in motion. So just a couple of FAQs that you normally hear. Can you use DocBuddy on an iPad?
Absolutely. So iOS or Android device, and then iPad or an Android tablet. So all of the above, you can use DocBuddy. Super simple. Don't have to buy a new device.
And then sort of related to the integrations question, how instantly does the data become available?
As soon as they hit save on DocBuddy, and that data is immediately accessible in Allscripts. I've seen it. I would say it's under 2 seconds, if not faster. You can dictate right in front of your computer and open the chart, and the data's there.
All right, and consider this, webinar attendees, consider this the last call for questions. One of our final FAQs to cover is, where does the data flow? As in, does it flow directly into the note fields or other discrete fields?
Yes, so the 6 note fields that Allscripts has, a reason for visit, HPI, plan, assessment and plan, all of those note fields are accessible within DocBuddy. And if your providers only use a few of those, they can actually hide those fields on DocBuddy and just use the ones that they prefer. And so they're specific to Allscripts, and it's seamless from that standpoint.
All right, well, we're out of questions. This has been very thought-provoking. Thank you, attendees, for your engagement, particularly with Dr. Weber. Andy, any final thoughts?
No, we really appreciate your time and consideration today. And as I mentioned, our team is anxious and excited about bringing value to your practice and to your providers. I would encourage you to visit DocBuddy.com. If you just click on the try it free, you're going to actually go right into onboarding your organization. And that takes about 2 minutes. And our account management team will be in touch with you. Happy to talk through any logistics, but as easy as it looked today, I can tell you that's the way it is. We can get you guys set up, and the way we even train remotely in the day and age that we're living in, we can jump on Zoom. Our account management team is awesome, and they can share their screen and go through any type of training. But as Dr. Weber mentioned, training is minimal. He picked it up in the middle of practice. Ashley and Shauna were there and said, no, you need to try DocBuddy. And they snatched his phone and he was off to the races. So in the same way, we want to bring value to your providers and start saving them time. So again, appreciate your time today and to learn about DocBuddy, and we're excited to connect with you soon.
All right, so in conclusion, a link to view an on-demand recording of this webinar will be made available for all of our registrants. And on behalf of DocBuddy and Allscripts, thank you for joining the January 2021 Allscripts App of the Month webinar. This concludes today's presentation.